right. Welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rory Alter, here with a very special person, Stacie Barber. You go by Stacie Barber, right?
Yep.
Yep. As some of you may know her as the Physio Fix on Instagram, but we're not talking about like treatment or like your business. We're actually talking about you and an injury that you sustained. So you're a doctor of physical therapy. You're a PT practice owner, and you're an Olympic weightlifter slash ex gymnast, I guess, or do you consider yourself still a gymnast? I don't know. Um, but you had a pretty serious injury in the last, I guess, year and a half ish. And we're in our foot and ankle month here at Progressive Rehab and Strength on our podcast. So we wanted to speak with you about your experience as both a clinician, a rehab clinician, and an athlete who sustained an Achilles rupture and went through with having a surgical repair. So we actually did also interview a unique scenario, a physical therapist, competitive powerlifter who had a full rupture without surgical repair. So we're interested in kind of getting both your experiences as an athlete, but with the physical therapy background behind it. So why don't you go ahead and introduce yourself? Tell us a little bit about your background, your hobbies, and your family life.
All right. Well, thanks, Rory, for having me. I know we've obviously been friends for a long time, but I've never been on your podcast. So
I
this is
know,
a
I'm
pleasure.
so excited.
I know. So yeah, my name is Stacie. My former last name, which some people still know me by, is Morris.
Yes.
But my new last name for the last 3 years now is Barber. So I am the owner and the founder of the Physio Fix, which is a physical therapy and sports performance facility in Phoenix. I was a solopreneur for the first 3 years of my practice and then kind of opened up a brick and mortar. The last 3 years, we're celebrating our 3-year brick and mortar facility anniversary like in September. So very exciting. Got like 6 team members now, like physical therapists on the staff, which is huge. And then like my background is basically I was a gymnast my whole life for 18 years, full college scholarship, everything, sustained a ton of injuries throughout gymnastics, just kind of part of the sport. And then I kind of got into physical therapy school. I went to Duke University, and that's when I kind of fell in love with the strength side of things. So I started doing first bodybuilding, and then I was like, this is cool, but I didn't really like how crazy people were on like stage and how like restricted they were. And I just didn't feel like it was for me. So then I found powerlifting next. And then I did the powerlifting route, and I competed in a few different powerlifting competitions. And then I found Olympic weightlifting. And from there, I kind of fell in love with the sport and how technical it was. And that's kind of what I've been doing ever since. I've been doing Olympic weightlifting for 10 years now. At a very high level. I've qualified for the American Open Finals 3 times now. I've never been able to actually compete in the American Open Finals, and I was going to actually compete this year, but I am now pregnant, as some people, may know. We've been trying for 4 years now, so this is super exciting. So I'll just have to qualify next year and then compete next year.
Yep.
No big deal.
No big deal.
Yeah.
So tell us a little bit about your weightlifting background and like what have you ever sustained any injuries with weightlifting?
I've sustained like little things here and there. So I would say that like, when I was first like new to powerlifting, I was that person that like didn't always know which volume to be like training within. So then when I would always like, try to max out, which is stupid. And my back would always kind of bother me. Yeah, very stupid. My back would just ache for like, I swear it was like weeks after I would like heavy deadlift. So I wouldn't say that was a true injury, but I would say that that was definitely like hindering my progress when I was a powerlifter. I also had a little bit of like shoulder stuff that would flare up, but I had 3 shoulder surgeries previously from gymnastics. And so when I was first starting to bench press, just trying to get the technique down and trying to like making sure that I was really tight and stable, that would kind of bother me from time to time, but no true injuries with the sport of either powerlifting or weightlifting, and which is kind of normal. I mean, I know that like you might get like, weightlifter's knee or any of that stuff, but these things aren't usually very traumatic and they're not very like serious that they need like surgical intervention. So I just kind of train through them.
Yeah. And I think it's interesting, because people look at barbell sports and just say they're so dangerous.
Right.
and you're going to get hurt and whatever. But relative to other sports that, like even my past history is dance and triathlon and yours is gymnastics. And you said, oh, you'd have some shoulder aches or pains but never like major injuries, but it's
Right.
because you had 3 injuries that led to surgery from gymnastics, so just looking at the relative safety of
Hmm.
barbell training, whether it's weightlifting or powerlifting, compared to other sports is pretty significant. But interestingly, you did have to undergo a surgery related to this Achilles rupture. So tell us
Yep.
a little bit about the rupture, how you sustained that, and was it related to barbell training?
Definitely not related to barbell training at all. Like I was the strongest I've ever been at that point when I injured it.
Mm-hmm.
And we were at our holiday party. So with my growing business, this was the first annual holiday party. We had enough team members to like have a party. And
Mm-hmm.
so we decided that we're very active individuals. We
Mm-hmm.
wanted to do something active.
Mm-hmm.
And so we went to like a ninja park. So it was like it was like one of those crazy things that there's like a rock climbing wall, there's like trampolines that like you can start playing basketball, there's a zip line, there is a warped wall. There's just tons of different things that you can do. And so I was, just being my crazy gymnast self. And I'm such a daredevil, anyways. I
Mm-hmm.
would just go to each thing. And I was like, let's do the trampoline first. And then I did the rock climbing wall. And then the next thing on the list was the warped wall. And I'm super competitive. So I was running up the warped wall and I got the smaller wall, which was like 14 feet in the air. And then I would try to do the 20 feet in the air wall. And it was like the third try. I was so close that I just pushed off really, really hard in that extreme dorsiflexion position, kind of running up the wall. And
Mm-hmm.
I felt it snap right away.
Yeah. I mean, I've done a Tough Mudder and there's that kind of wall. And I just remember how many attempts it takes people to get up and over it. And I just remember when I did the Tough Mudder with my husband, I got over in like 3 tries. And then my husband just kept watching him from the top, just keep trying to go. I mean, but it's hard. And it is that extreme dorsiflexion. So if the listeners go back to our functional anatomy on the foot and ankle episode, we talk about what you need in terms of these different ranges of motion, how the foot functions. So, and tendon ruptures happen from a quick lengthening with contraction to the tendon. So, a forceful lengthening and contraction. So, you were like in this position that just was rel- a prime position for snapping.
Yeah.
Do you have any like PTSD related to this injury?
Oh, for sure. And since it's funny, I've been invited on the American Ninja Warrior show since,
Oh my gosh.
and the warped wall is like one of their main things in
Uh-huh.
this contest. And so the first time I got asked, I was like, there's no way. Like I have so much PTSD
Uh-huh.
surrounding this specific thing.
Mhm.
And then like I thought about it, I was like, what a great like way to get back, and
Yeah,
I was
like
like,
a
I
comeback.
think eventually I
Yeah.
think eventually I'll do it and get on the show, but like for right now, I'm still very much apprehensive to that movement.
Did you have to try out for that? Or how did you
No,
get the invite?
they reached out to me. They said that they were really interested in bringing on a lot more female
Uh-huh.
contestants, and my name, I guess, was given to them. And
Mhm.
so they were reaching out to me, and they said that it didn't have to be this season. I was
Mhm.
invited to, but I still have to apply. So they've
Right.
already reached out to me, and then I have to still go through the application
Right, right,
process like
right.
everyone else.
That's so cool. Oh my God. Well, I'll be
Yeah.
rooting for you. I don't normally watch it. Like I'll watch like reruns that come on, but
Yeah.
we have like the parks or like the gym, these like ninja gyms are opening up everywhere. There's one like 10 minutes from me and I've always been like, I should go. And then I'm like, oh, but I might get hurt.
Ex- yeah.
I
After 30, it's a very real fear to get
Oh, well,
hurt with these things.
speaking up, yeah. How old are you? Just so
I'm
our
34.
34. Yeah. And it's funny. I was doing check-ins. Monday is my check-in day, not usually my podcast day, but we wanted to have you on. And one of my clients, she's touring Europe right now doing this like tango festival. And she's 40 and she goes, I forget exactly what she said. She's like, it sucks trying to relive your 20s when you're 40, you know? Like we
Yeah.
don't recover as much and our bodies have been through more. Our bodies have just been through a lot of reps, and the more reps you do, the higher exposure you have to injury. So it's kind of just like aging and illness also, you know, like our life expectancy is higher now. So we're seeing more illnesses and cancers and everything in the
Yeah.
population. So the same thing happens on the microcosm of the human body, you know, like just the older we get, the more susceptible we are to things. Um, so when you tore your Achilles tendon, had you like had any inkling prior to obviously this was something that you weren't doing on a regular basis. It was like this one time isolated thing. It's not like you
Mhm.
were going to this ninja gym all the or were you? I don't know, maybe you were.
No, I was not.
So you know, you hadn't been exposed to that type of
Right.
stress on your ankle, but you do Olympic weightlifting. So your body is used to taking force through the leg, like in that similar fashion, but
Yeah.
not like a deep dorsiflexion,
Right.
you know. But had there been any inkling of ache or pain or anything going on in that ankle leading up
No,
to that?
I haven't had any ankle injuries for as long as I can remember. When I was a kid, like an adolescent, I had Seaver's disease, and that's very common in gymnasts, just for
Mm-hmm.
growing pains and
Mm-hmm.
on the, you know, that
Mm-hmm.
calcaneus. I had that, and
Mm-hmm.
that was the last time I had any injury. That was probably when I was 12 years old. So it had been at least 20 years,
Mm-hmm.
no problems at all. I have, you know, full range of motion of my ankles, both sides, you know, full strength. And like you said, I do train that like quick explosive, like
Mm-hmm.
movements all the time, but not in that extreme
Mm-hmm.
dorsiflexion
Mm-hmm.
positions.
Yeah. um that disease that leads to the like growth on the like bone spur at the bottom of the Achilles.
Not always. No. So
Do you
the
have
bone
a bump
spurs,
or no?
I do
No.
not. No.
Okay. All right. Was it the same side or was it both sides?
I had both sides. So when
Okay.
I was growing up, so yeah, it just happened to be that I think this one was a little bit worse than the other one. So I had to have like a boot on longer. They used to cast us and boot us for
Mm-hmm.
this.
Mm-hmm.
So I remember having a boot and a cast on that leg
On
for a
that.
longer duration.
Interesting. Interesting. So we did a podcast on I mean, I didn't tear anything in my ankle, but I have a ankle range of motion deficit from one side to the other, and I had been casted in my in the side that I have the deficit. I had been casted for quite a long time in that leg, and also like a night splint as well. So that's interesting,
Hmm.
just to think about it. You know, we don't think about these things and the implication that they have on us long term. You know, I
Hmm.
mean, we do as physical therapists, but even as physical therapists, like when did you ever think about that until you
Right.
know the injury?
Till
You
after
know,
it happened.
right,
Yeah.
exactly, because it didn't affect you in your normal daily activities and your athletics because you didn't need that range and you didn't need the strength in that range. um, so it's just interesting. So as a physical therapist and high level lifelong athlete, what was your initial response to the injury?
First, it was, "Oh my gosh, I can't believe this happened to me." You know, that was the first thing I thought about, especially like at our holiday party. You know, it's
Yeah.
my business, and I'm like, I'm the one that gets hurt, right? But you know, I guess I'd rather it be me than anyone
Yeah.
else. So, but it was just like so embarrassing, like that this would happen in the very beginning of our holiday party. So, for that was my first thought. My second thought was, what did I do wrong
Right.
to have this happen? You know,
Mm-hmm.
and then that's when I was thinking about what could have been a precursor to this, and I couldn't really, you know, other than that 20 years ago, it's like
Mm-hmm.
I'd done high level, you know, elite gymnastics and nothing had gone wrong. And that,
Right.
you know, tends to cause a lot of Achilles ruptures these days anyway. So I'm like, that didn't happen to me back then. Why now?
Yeah, and
So,
I feel like you work with so many people who have like foot and ankle injuries that you're like always demonstrating these exercises for the foot
mhm,
and ankle. So like you should, you know, like you're more primed than anyone else. You know, as
right.
physical therapists, when we demonstrate this stuff all the time, I feel like we're primed, but we're not apparently.
I know. No, I guess not anymore. And then I guess the third thing was, how do I like, you know, make something good come out of this bad situation?
Right.
And
Yeah.
that was, you know, when I was like, well, I'm going to decide to like kind of film everything that I'm
Mhm.
doing and
Mhm.
make sure I document my entire
Mhm.
process. You know, I started to create a YouTube vlog about
Mhm.
all of this
Yep.
and started to show people on Instagram and make sure that I could help educate because there's still so much like unknown when it comes to Achilles and
Mhm.
protocols. And I wanted to make sure that I like really helped people in the future by creating like some sort of protocol or something that
Mhm.
could help guide
Mhm.
people.
Yeah. Um So first of all, I want to get the links to your vlog so we can link people to that because
Okay.
I think that'll be really helpful. So I'll put those in the show notes for anyone who's listening. I'll get specific vlogs from you so that they can just go straight to them. But like I said, we spoke to another physical therapist who is a competitive power lifter. Obviously, a little bit different than Olympic
Hmm.
weightlifting. There's no jumping and that landing on the ankle.
Yeah.
So he decided to go the non-surgical route. So
Hmm.
talk to us a little bit about the process after you like immediately ruptured it. How did you walk out of the holiday party that night? And then what was the course of action that you took after that in terms of getting consultations? Did you consider non-surgical? And how did you make your decision?
Yeah, so that same evening, I am really good friends with a few different orthopedic surgeons in this area, as we kind of all are. And so I had someone on, could text him, a doctor. So I
Mm-hmm.
texted him right then. I was like, hey, this just happened. Like, do you happen to have any openings tomorrow? Can I come in, get
Mm-hmm.
an MRI, and kind of see like what kind of damage? Like, I was still hoping for like a partial tear at that point, even though
You
I knew that it
knew.
was fully torn.
Yeah.
Yeah. So he was like, yeah, go ahead and come in tomorrow. We'll go ahead and order the exams and kind of go from there. So in the meantime, I got home that night. One of my teammates, one of my coworkers, he brought his scooter from when he was like injured. So I was like, okay, let me get on this scooter, started scootering around. And then I got home and started doing research. And I'm researching like, non-op versus
Mm-hmm.
operative route. And they're both kind of comparable at a certain point. You definitely see that like the people that do the operative route are better at first, but
Mm-hmm.
then non-op route, they kind of even out,
Mm-hmm.
around that like
Mm-hmm.
16 to 20 weeks
Right.
anyways.
Right.
So I was like, I'm willing to do either one. I'm definitely, as a physical therapist, pro conservative treatment, and I think that, anytime that we have a surgical intervention, there's definitely scar tissue and other complications that can arise from that. And I had 10 orthopedic surgeries already in my
Mm-hmm.
body. And I'm like, I don't want to have any more.
Mm-hmm.
So I really wanted the non-op route. So
Right.
when we got the MRI, it showed that there was a 9 centimeter gap in my tendon, which is massive. That's like 3 inches. And that's when it's completely at neutral. That's how they measure the gap.
Mm-hmm.
And then they take your ankle into the extreme amount of plantar flexion to see if there can be any kind of overlap in the
Right.
tendon.
Mm-hmm.
And mine didn't have any overlap. So that just told my surgeon that I was not a candidate for the non operative route,
Ah.
that I only had the option to do the operative route.
Mm-hmm.
So that's why I chose that route.
Gotcha. All right. So, I mean, did you know that bit of information in terms of how they make the decision for surgical versus non-surgical in terms of the length between the two ends? No,
Nope.
this is news to me. So that's pretty cool. But now it's cool as we go through these things as clinicians, when we go through
Hmm.
these things ourselves, we learn more about the experiences that the client might be going through, and what might, to help them make decisions. So I think that, as much as it sucks to get hurt, it does I feel like every injury makes us a better clinician. So how long? Well, first of all, I actually didn't ask the Martin who we interviewed. I didn't ask him this question, but I'm curious because sometimes we hear that once it's torn, it doesn't hurt. So so what were you experiencing in terms of pain?
I had a lot of pain. So I don't know like who's throwing that myth out, but it is a lie. I
Yeah,
was in so much pain. Like, and I didn't cry that night. A lot of people like I wanted to cry. I cried when I got home because I was so
yeah,
frustrated.
right.
But like I was in so much pain. I just like kind of sat there. But once again, I had all my coworkers around me and I was like, I'm gonna be tough. Like I'm strong.
Right.
Like I don't want to show that like this is like getting me down because then we still have like 2 more hours of our holiday party. Like
Yeah.
I didn't want it to affect everyone else. So I just didn't let it get to me at that moment. But I was like already getting excruciating pain. It was already starting to swell up and it was just really becoming like stiff too at
Hmm.
that point. And that was kind of a lot of the pain. And then
Yeah.
obviously we did the Thompson squeeze test and, nothing's happening there.
Full tear. No
Yep.
movement.
Yep.
Yeah, so for anyone listening, the Thompson test is when you're lying on your belly with your feet hanging off the edge of something, And if you squeeze the calf and the Achilles tendon is intact to some degree, there should be some movement of the foot into like the pointing position. And when you have a complete rupture where the tendon is no longer intact, that foot does not move when you squeeze the calf. And it's not a pretty thing to see. It's like, wow, that foot looks dead.
Yep.
Oh man. So that's definitely, I mean, it's cool that you're obviously a tough human being. You wouldn't be this level of a business owner. You wouldn't have such a success as a business owner, and be at the level that you are in terms of your athleticism if you weren't mentally tough. But I think that injuries for anyone can be extremely challenging, and being with your staff and just like knowing that every single one of them supports you and knows how to
Mhm.
deal with this, um, probably helped you a little bit mentally in the moment. But also, instead of bursting into tears, you kind of had to hold it together because you're like the boss and the ringleader,
Mhm.
which can also be challenging, like to
Yeah.
kind of repress those immediate feelings. So I'm not
Mhm.
surprised that when you got home, you were like, oh
Oh, yeah.
no.
My husband heard
What?
all about it.
Oh, so he wasn't at the holiday party?
No, he was, but, I was
Oh.
keeping it together until I got
Yeah.
home, and then he was like, "Oh, where did this come from?" And I was like, "It was
Aw.
there all along."
Aw. All right. So before going into surgery, what were some of the concerns that you had? Or did you not? You were just like, I know I
Um
need this, or
Yeah, I think the main concern was like the protocol, because
uh-huh.
everyone's protocol is so different. And I wanted to make sure that my surgeon, which, he's a good friend of mine, that he knew what I wanted to get back to.
Mm-hmm.
And I kind of told him that, I want to get back to being able to do all the gymnastic skills that I could do before, which
Mm-hmm.
isn't everything gymnastics that I used to be able to do, but at least I could do like standing backflips and like
Mm-hmm.
aerials, like
Mm-hmm.
whenever I wanted to. And then I want to be able to get back to Olympic weightlifting. And, I'm a pretty, big competitor there. So he was like, okay, so I want to make sure that I put extra anchors in your heel to be able to allow you to do this. So
Right.
he kind of came up with a different game plan. He was like, I'm going to kind of blend a couple of different procedures, but I won't know for sure until I get in there to see like
Right.
what, all the damage and see like what I can do. So at least I like kind of told him what I wanted, and he was like, I'm on your board. We can definitely like make sure that we achieve these goals together.
Yeah,
And
I think that's so important, as physical therapists, we're our patients' advocates, but we can't always go to the doctor's appointments with them. And I think that, if anyone's listening to this and is on the fence or about to have surgery of any kind, if your doctor is not on board with you returning to the level of athleticism that you were prior, then there is a surgeon out there who will be.
yeah,
And it's not the right surgeon for you. And you need to be able to have those conversations, and the doctor you want to find a doctor who will make do everything that they can to secure that you have the opportunity to go back to that level.
yeah. Yeah,
Yeah.
so that was really important to me. And then, he said that he was going to put me on an accelerated protocol and kind of give me more autonomy there
Oh,
to be able to
gotcha.
get me to weight bearing quickly.
Uh-huh.
And then I could start like, moving around and doing some strength training movements at
Right.
that point.
So what was the difference in length of time between his accelerated versus standard protocol?
3 weeks. So he like let me go into weight bearing at 5 weeks versus what he usually has people do is wait till 8 weeks.
Wow, gotcha. That is a big difference, and I think it makes a huge difference in terms of the preservation of the muscles in your hip and your quad and all that kind of stuff. Because when you are weight bearing, even though you're not squatting as much as you used to, obviously you can do exercises in the gym that are non-weight bearing, and you can address the hip and the quad and hamstring. But weight bearing has a really important role in preserving bone mass and muscle mass, and all that kind of stuff. So that's good. So you were on a scooter for a bit. Oh no,
Oh yeah.
you had, because I don't think a lot of people know about this, but you had that little like
I
peg
walk.
leg. I walk, is that what
Yeah.
it's called?
Yeah. Yeah. So yeah, I had the crutches, I had the scooter, and I had the iWalk. Different things, different devices for different things, you know.
Mhm.
So I would definitely like use my iWalk when I was treating patients because, you know, as the business owner, and I had a student at that time too that had like 1 week left of her rotation. So I had to get back to work. I
Mhm.
had surgery on a Wednesday and I was back in the office on Friday treating
Wow.
patients.
That's
Yeah,
incredible.
so I was like on my iWalk, like doing manual assessments, you know, trying to, you know, do everything like normal, and it was exhausting. But then I, you know, when I got tired, I'd go onto my scooter and just kind of
Mhm.
like sit on the scooter for a
Mhm.
while. And then I had my crutches for like at nighttime, just
Mhm.
going like back and forth to the
Right.
bathroom.
How long between when you had the injury and when you sustained the injury and when you had the surgery?
2 days.
2 days. Yeah, you know, you were very lucky to have the
Yeah.
surgeon as your friend on speed dial, basically.
Yep.
But yeah, for a lot of people, it can be like 1 or 2 weeks. You know, if you call an orthopedic surgeon's office and you say, I have a complete rupture of my Achilles, obviously they're going to squeeze you in faster than someone who's like, I have some ankle pain.
Right.
um, but so you got back pretty soon, but it does take a very it's physically exhausting on your body, especially when you go, and we always talk about load management and progressive overload, and the same thing applies to assistive devices. You know, like you went from walking on 2 feet to having a surgery in 3 days basically,
Hmm.
and then now you're using all of these different assistive devices that put pressure on your body in different ways. So did you experience like what did you experience with that?
I was having so much stiffness, and my doctor, he even said, he was like, "You need to make sure you do a lot of hip mobility and stretching." And I was like, "You're crazy. I'm like the queen of mobility." You know,
You
I was like,
are.
I was like, "I'll be fine." And he was like, "No, you're going to feel really, really stiff." And I didn't like think too much about it. But the more I was on the scooter, the more I was on the iWalk, the more like off kilter I, you know, felt when I was like walking or
Mhm.
like, you know, scootering around. And the more like, you know, I would have so much quad and hip flexor stiffness on my surgical side
Mhm.
because it was always kind of stuck into a little bit of flexion,
Mhm.
you know, and with that, it just almost felt like a contracture, you know, like
Yeah.
in my hip.
Yep.
And so I felt like I just constantly wanted to stretch that out. So like part of my like evening routine every night was to stretch like the quad and do the couch stretch and all that stuff because if
Mhm.
not, I would have so much tightness, even like that would keep me up at night for
Mhm.
bed.
Mhm.
And because your leg has to be elevated anyways while you're asleep.
Oh.
So now you're in flexion even more, you know, so it's just always you can't get out of that position.
Mhm. Oh
So
man.
I was feeling that. And then I guess other than that, my other side, I just felt like it was like doing all the work, you know?
Tired.
So
Yeah.
yeah, I was hopping sometimes like to the bathroom if I forgot my crutches. And then I was like, oh my gosh, I need to stop doing this because now my right side's starting to ache a little bit.
Mhm.
And I definitely don't want this to happen on that side because you start thinking about PTSD again, like this whole process of being like
Mhm.
non-weight bearing for 5 weeks. It, you know, doesn't sound like that much time, but it's like
Right.
life or death to some people. And I like
Right.
felt like I lost all of my autonomy and I
Mhm.
had to ask for help to do every single thing.
Mhm. Like what kinds of things?
Like even like going like to the office, I usually bring my dogs to the office. They're like emotional support dogs, and I couldn't even get my dogs in the car without having my office manager come to my house
Mm.
to help me put the dogs in the car. You know, so it was like every single day, it was like this whole process of a huge change. And I
Mhm.
couldn't do dishes like because I was like so fatigued, and I couldn't do laundry because I couldn't get into my laundry room. You
Mhm.
know, it was like
Mhm.
all these like small things that you don't even
Mhm.
think about
Yeah.
that are now impacted by this one thing that happened.
Right. Was it your right or left foot?
My left foot.
Oh, well, that so you could still drive.
I could still drive.
Thank God. But like grocery shopping, I'm sure was challenging. But thank God for
Mhm.
delivery, you know?
Yeah.
So, I mean, that's the thing is, and I think that's what's so challenging with surgeries. And one, you know, obviously this surgery was unavoidable, but, but a lot of orthopedic surgeries are elective. And when we're considering if you should have an elective surgery or not, you know, we have to like I don't think people think about these things
Mhm.
um in terms of like they just think about the pain and that the surgery is like the only option, but it's not.
Mhm.
I mean, for you obviously it was, but these are the types of things that people don't talk about is like bathing, dressing, getting to work, you know, how much the rest of your body has to do all the work and how tiring it is for your whole body and that kind of thing. So, um just like these are things that you got to consider.
Yeah. And if I had a little bit more time, like, if I did plan my surgery for a little bit later, which, you don't want to plan it for too late because you don't want things to start degrading too. Like if you want the
Mhm.
tissue integrity to be good.
Right.
But I also would have had time to get all my assistive devices because like
Right.
some of them were slowly coming in. Like,
Mhm.
Amazon's great, but not everything is like 2-day delivery.
I know the whole
And
Amazon Prime thing. I heard that like some people are like suing Amazon Prime for
mhm.
I don't know exactly what it is, but my guess is that like we used to get like 2 day shipping or like next day shipping, but now it's like they can argue, well, you get all the movies and the music and that's what you're paying for. But yeah, we used to get things so much faster from Amazon Prime.
Yeah.
But so, in terms of the healing process and any complications that you experienced, other than like the stiffness and the off kiltered and the hip flexor and quad stiffness, were there any complications?
Yes, I'm sure you are aware, but so I was actually doing really, really well. So I was, out of off of the scooter and kind of doing the weight bearing thing at 5 weeks, and then I was finally off of my boot at 8 weeks, so that I was back into like a shoe and
Mhm.
just like kind of walking around and starting to strength train, starting to lift. I was even doing like, like muscle snatches, like all like those things, and everything was
Mhm.
going really good. I could do a single leg calf raise by 12 weeks, which is kind of unheard of, but
Mhm.
I was very like determined to get that goal. And I started jumping like at 12 weeks too, once I got my single leg calf raise. So I started doing like jumping and all that stuff. And then at week 14, something happened and my Achilles popped. And during rehab, I was just doing some simple line hops, which I
Mhm.
had done the week and the week before. So
Mhm.
for the last 3 weeks at that point, and I was going just forward and back. And I just felt like a little pop. It wasn't like my original Achilles rupture. So I was
Mhm.
like, is this something that's different? Is it the same? I could still do calf raises after that. So I was like, okay, I don't think it's ruptured. Maybe it's
Mhm.
scar tissue.
Right.
Maybe
Yeah.
it's
Sometimes scar tissue makes a really loud noise.
right. Yeah. So I was thinking all these different things. I was like, maybe that. And then just kept going on with my workout at that point. And then I did another like little hop side to side and it popped again. And then I was like really concerned and I like sat down, freaked out, started crying. I'm like, this can't happen. Like I could still do calf raises at that point, but everything was starting to swell again.
Mhm.
And I was getting like a lot of bruising on the inside of like my ankle and my calf. And so, I remember I reached out to my doctor and I told him what happened. And he was like, oh, I'm sure you're fine. And I was like, I don't feel fine. And I also
Yeah.
feel like I won't be okay unless I get some like reassurance that everything is actually okay. Like I don't want to push it and it cause further damage.
Right.
And so he was like, well, just come in, I'll look at it. So he booked an appointment with me like for the next week because I wasn't high priority at that point,
Exactly.
right? So I went the next week and I told him what happened, and he was like, "No, I'm sure it's fine. Like, it's going to be really hard for you to damage a surgical repair." In his mind, right? He had done his
Right.
job. He was
Right.
like, "Everything's fine." And
Right.
so I was like, "I don't think everything's fine. Like, I know my body really, really well." And I was like, "I also have it on video. Would you like to see it?" And so I showed him the video, and I turned the volume up, and he heard the pop, and he was like, "Let's order an MRI." And he walked out of the room. So,
Ah,
so we get the MRI and it's a partial tear, a 90% partial tear. So 10% was still holding on. And it was like something that was like partial torn in the inside of it. So not on
mhm.
like the
The 2
outsides,
outsides were yeah.
they were fine, but the inside was what was 90% torn and it was a longitudinal tear. So he was like, "What do you want to do?" And I was like, "Well, I don't want to get surgery. Like if it's something is still attached, I feel like it should be able to heal itself." And he was like, "Well, why don't you go get a second opinion just to make sure that that's also what another surgeon would advise?" So I went to another surgeon. He also didn't recommend surgery. He said, "At this point, there's too much going on with the healing process
Mhm.
in your Achilles. It would just be kind of like a catastrophe if we opened it up and be so much scar tissue. And I think that you should just do a PRP injection
Okay.
and then just, be non weight bearing for another like week or two, go back and do a boot for a period of time and plantar flexion, and then slowly progress from there."
Mhm.
So at that point, I had planned on doing the PRP. I already had booked the appointment, and then my dog broke his leg.
Oh my
And
god.
yeah. So I never ended up doing the PRP because I was going to have to be non-weight bearing for a week. And there
Mhm.
was no way I could carry my dog up and down
Mhm.
stairs, me being non-weight bearing too. So
Right.
I just decided to let my body do what it's supposed to do and just let it heal naturally. And that's when I actually got into cowgirl boots like full time. I don't know if you saw any videos.
Yeah, I saw a couple actually. It's so funny because my dad has had like a chronic Achilles tendinopathy, like whatever.
Yeah,
Back then they called it tendonitis.
right.
And he always wore motorcycle boots because it just feels better. But yeah, I mean, when you want to be fashionable, but you need a little elevation to your heel.
Yeah, yeah, exactly. So I was like, these boots put me in like 25 degrees of plantar flexion.
Hmm.
They say the optimal healing for an Achilles is 22 degrees of plantar
Hmm.
flexion. So this is what I'm going to be in for the next like 4 to 6 weeks. I was in cowgirl boots
You wore them
nonstop.
at work?
I wore them at work. I wore them like I went to like a weightlifting competition coaching one of my athletes. I wore them there. Like I wore them everywhere. I worked out in them. So I would
Uh-huh.
still do squats and
Uh-huh.
deadlifts and all the stuff in my cowgirl
Awesome.
boots.
That is awesome. I don't know. I feel like I remember seeing some posts with either stories or whatever, but I don't remember
Mhm.
like the full effect of the cowboy boots. Um, but I think it's interesting that I mean, just as we mentioned when you had your doctor on speed dial and it first happened, he was like, "All right, let me get you in." But then,
Mhm.
the doctors there. I mean, he might be a good friend of yours. I don't know, but like the attitude or priority shifted a little bit once he already
Mhm.
did the surgery, and you could see just in that response, he's like, "Well, it can't be my surgery that's messed up." Um, but
Exactly.
I do think that it it's it was interesting to see that he did send you for a second opinion.
Mhm.
Especially when people do surgery. I feel like maybe it's more in the hand or the actual foot, but they don't like other surgeons don't like to see other surgeons' surgeries. But that is cool that he did, have the what is the word I'm looking for? Um he wasn't like
Yeah,
he was
I think he was forthcoming with, like, that
yeah.
information. He was like, "I might not have the answer, so why don't you go see if
Yeah.
someone else can"
Swallowed
yeah,
his
either
pride, so to speak, if that's kind of what you're
yeah.
saying. And he's like, go get a second opinion. Um, I think a lot of people get confused or scared when they see like a 90% tear, but they don't understand the difference between like a longitudinal tear and one that's like a cross section of
Yeah.
the tendon. So longitudinal tear is something that's kind of like the same, goes in the same direction as the muscle, versus or the tendon, versus the rupture is like it splits in half and separates. So a
Yeah.
90% longitudinal tear is not so bad as a 90% tear that like
Horizontal, yeah.
horizontal tear. Um, so talk to us a little bit. I mean, obviously you told us a little bit about the assistive devices and how long you were non-weight bearing, and what training looked like a little bit up until there. But what did your training really look like? A lot of people are like, oh, well, I had surgery. I can't go to the gym, but you were like back to work the next day. So I'm sure you were back to
Mhm.
training as soon as you could. So how did
Yep.
you modify training? You have a really strong upper body. You do a lot of standing, pressing. I always see you doing pull-ups, chin-ups, hanging from things, doing those like
Mhm.
sock challenges. you know, so we talked a little bit about in some of our other podcasts because we talk about training with one leg, and some of the s- difficulties that people who are non-weight bearing can face when it comes to training, like loading plates or things like chin-ups and pull-ups where you have to you could fall and land on two, like where you have to
Mhm.
jump down or jump up or whatever. So talk to us a little bit about how you modified your training, what things stayed the same, and what things were different.
Yeah, I tried to keep as much the same as I could. So I was continuing to follow the same plan that I was already previously following. And all I would do was I would make sure I put all of the equipment. So I'd bring all the equipment to one area because no
Mhm.
longer could I go back and forth and cross the gym. So I would try
Mhm.
to bring everything to one area so I didn't have to go back and forth. And then I would definitely have like lots of benches. So like when I would do instead of doing normal deadlifts or RDLs, I would do knee propped. So I'd
Mhm.
prop one knee up on a bench and then I would go towards the end of the bench. So I could still use a barbell and
Mhm.
just now do like barbell stuff at the end of the
Mhm.
bench.
Mhm.
I would have a bench, under when I would do like bench press, I would always pair that with pull ups. So
Mhm.
I would do bench press and then then stand up on the bench and then kind of stand on the actual barbell too, and then
Mhm.
go up to the rack. So then I
Mhm.
didn't have to worry about falling. So
Mhm.
everything was just really easily accessible for like snatching and for like cleans and different jerks and stuff. I would do kneeling movements. So I would do a kneeling snatch so I could still use both legs. And so I just use a box and have my foot hang off the end of the box.
Mhm.
And so it wasn't like, limiting me in any way. And so now I'd still use my barbell and do the same like muscle snatch. And I do the same thing with the clean and then kind of just go into like more of a hinge
Mhm.
movement for the clean portion. And then I would do for the jerks, a kneeling jerk. And then I would
Mhm.
catch with the opposite leg forward to
Mhm.
still like simulate that, but I would still be able to do it. And same with like push pressing. So I do
Mhm.
kneeling push pressing. I would do even like seated dumbbell snatches. I would do like seated press to windmills. So
Mhm.
everything I was just like kind of making it more of a seated or a kneeling based
Mhm.
exercise. There wasn't much that I couldn't do. Obviously, I couldn't squat, but I could do like knee extensions, and I would do
Mhm.
a crap ton of knee extensions and hamstring curls. Um, I would use a power band to do other like versions of like a TKE. So I
Mhm.
would like go on my like hands and knees and then just like, be in that kind of quadruped position and using the band to do like a knee extension
Mhm.
motion. And so I just like kind of get creative with different things. But, this is what we have to do every day with our patients too when they're
Exactly.
facing an injury.
I
So
know
it wasn't too hard.
yeah, we're good at this. I know that for a lot of people, listening to this, like, well, what the heck? I don't know how to modify everything. Which is why it's really obviously like you and I, we could do that stuff for ourselves, but it's really important, especially first and foremost, you didn't stop training. And this
Hmm.
is like a huge surgery, a huge injury that could potentially, people kind of go into like, oh, I can't train. The doctor says don't go to the gym. It's unsafe, but there's always a way to keep training. So upper body should really go unfazed. The only thing that you have to think about is like, how do you modify your stance or your position so that you can keep training your upper body without bearing weight through the leg. But you literally, like you just show us that you do not have to stop training and everything is modifiable. Think about like people who experience amputations,
Hmm.
we have adaptive sports, we have para athletes, like they can compete still, so if they can do it and if you can do it, everybody else should be able to continue to train. So we want to just obviously inspire people, that no matter how significant your injury is or how significant it
Hmm.
might feel to you, the most important thing is to keep training in some capacity. Because I think that a lot of people, when they stop training, they get out of the habit and it's harder to regain momentum and get back into it. And when you've lost so much time, and people say, well, once you restart, you're like, oh my God, I'm so behind, or I used to be able to do this or that. You will feel less of that if you keep training.
Yeah, and when I was able to actually start doing all the normal training again, my numbers weren't too far off of what my
Mhm.
old numbers were.
Mhm.
The biggest like difference was like squat. Like my max squat was different than my max squat before, but
Mhm.
my snatches, like when the first time I tested my snatches, I was able to get 85% of what I'd been able to do previously, and I
Mhm.
couldn't even walk really for 8 weeks.
Yeah.
So it was like,
Mhm.
it was just goes to show that how much strength that you can maintain when you
Mhm.
still do something.
Yeah, and using the other limb has carryover to the
Hmm.
injured limb. So definitely that's a huge thing. Um Talk to us a little bit about your reintroductions to squat, and the Olympic lifts in terms of getting that foot on the ground and loading it in a plyometric fashion.
Yeah, so I first started doing like box squats. So I did like more heels elevated stuff
Mhm.
at first too. So I'd have like a wedge because I didn't have good dorsiflexion, and you're not really supposed to push dorsiflexion until after 12 weeks.
Mhm.
So when I started to squat at like 8 weeks, I didn't have full range of motion of the ankle. So I would go wedge position, heels elevated, squat to box, and then just slowly decrease the box height. And then I would decrease the wedge height. And then just, before long, I was on the ground. And then I would start doing like barbell squats. I started with goblet squats, of
Mhm.
course. And then I'd go to barbell squats, the same sort of progression. And then I would go, like almost near maximal weights that I was doing before, which is just to a box.
Mhm.
And then I would take the box away and then start going further and further down to the ground. And then from there, I was starting to slowly incorporate more of the strength training for the calf and I was doing more jumping and stuff at that point. So I'd start doing like some more dynamic based like calf raises. So like ballistic or like really like squat push, so everything was kind of moving more dynamically and higher velocity. And then I would start doing more of a jump, so I'd start doing more box jumps and start adding that stuff in. And then as I was adding more of that stuff in, I would add in more like clean pulls and more snatch pulls and all that stuff. And then until it was just a natural progression to start actually doing the snatch and start doing the clean and start doing the jerk. And I'm lucky that my left leg is first in my jerk, because if my left leg was back, that would have been a lot more scary, but I was able to start jerking pretty quickly.
How long was it between when you had the injury and when you were able to get like your full squat, like barbell back squat with your normal shoes at like a decently close to the prior strength level, and also your Olympic lifts? How long did that take?
I tested everything around 6 months, and I was pretty much back to kind of where I wanted to be to start a training block.
Mm-hmm.
So it was like between that 20 and 24 week mark.
Mm-hmm. Yeah. That seems pretty standard for like non-rupture surgeries,
Yeah.
which is good. Like we, kind of feel like if you had a rotator cuff repair or,
Right.
but I think sometimes people look at like ACL reconstruction or rupture repairs and they take longer. But
Mm-hmm.
definitely like that is pretty awesome. 24 weeks, that's like 6 months, right?
Mm-hmm.
Yeah. Now in terms of gymnastics.
Yeah. I didn't start doing gymnastic stuff until I hit, I think it was 8 months. So,
Mhm.
I first took the month 6, the month 7 to really focus on Olympic weightlifting, started like a training block for that and doing more like higher velocity plyos, agility, stuff like that,
Mhm.
just to feel more like an athlete. So as I was adding more of that stuff in, then I was ready to start kind of at least thinking or considering doing some gymnastics movements. So we have an air track at our facility, which if you're not familiar with what that is, it's just like kind of like a bouncy piece of
Mhm.
equipment that we can put right on top of the floor. That's kind of
Mhm.
like a tumble track or a
Mhm.
trampoline,
Mhm.
So we got that out, and I was working with Haley at this point. So the cool thing about my facility is I would work with different clinicians at different phases of my
Mhm.
recovery. And since Haley was a former gymnast and she works with a lot of gymnasts, she was the one that I wanted to help me get back to all my gymnastics skills. So
Mhm.
she would just have me do various different drills and have me like visualize that I could just do it. And then there was one day, I think I was right about like 8.5 months, that she was like, "Are you ready to try it?" And I'm like, "I guess." Like, like in my head, I can still do it, but like I'm not sure if my body is capable of what my mind thinks I can do. So she was like, "Just sit down, visualize it." And then she was like, "I'll spot you." So she spotted me on a back tuck, and it was like higher than it was probably before my injury, because I had done so many plyos and
Right.
so much strengthening to like get this movement down. And I was obviously scared that I was going to like under rotate, because the jump wasn't the scary part. It's more the landing, because
Yep.
you're landing in that dorsiflexion position too.
And the lower
And
you
so,
land, the more dorsiflexion you probably need
correct.
because you got your
Yeah.
toes under you.
Yeah. So I just did it, and then I was like, I can do this. So I just kept doing it. And I think it was like the next week that I did it on the floor. So it
Mhm.
was like very quickly, I just remembered that I can do these skills. Like I believed in myself. And,
Mhm.
and then it was like maybe a week later that I did aerials. So it wasn't too long. I probably only needed like a month of gymnastic specific things
Mhm.
to be able to get all those skills back.
Awesome. So, what was the biggest thing that you learned from this injury as both a physical therapist and an athlete?
I think one of the things is learning to ask for help. And that could be asking for help from friends or family, like, because this is such a detrimental injury, like mentally too. It makes, people very depressed, and it's easy to see why, because you can't walk for
Mhm.
so long and you have to ask for help, and your whole life is kind of flipped upside down. So asking for help, but also like advocating for yourself. So, I had to make sure I advocated for myself every step of the way, and make sure that I had let people that were working with me know like how I was feeling, because, every day wasn't a good day, and they had to meet me on like where I was at on any given day.
Mm-hmm.
And then my surgeon too, like if I didn't advocate for myself, he would have probably never ordered the MRI. He would have probably, just like disregarded it because he had done his job.
Mm-hmm.
So making sure that I tell other people too that are experiencing these injuries, like there's no harm in going back to the doctor and getting a second opinion or getting reassurance that everything is okay.
Mm-hmm.
Like maybe your doctor might fight you on it because, they're like, oh, that's so unnecessary to get another MRI.
Mm-hmm.
But if it's what's going to give you peace of mind, that's what I needed at that point, that I really needed that. And so I can just really, really understand what my patients are feeling when
Mm-hmm.
it comes to that stuff.
Yeah. So I want to talk to you a little bit about insurance, because I think that that's like another element that people don't understand about surgeries. And as physical therapists, obviously, you are out of network or in network with some.
We're in network for Blue Cross Blue Shield, but then out of network for the others.
Okay. Um, so in terms of your own personal insurance and how that played a part in covering your doctor's visits, your surgery, and your assistive devices, how much, like, talk to us a little bit about the process. Did you experience any like surprise bills or things that you weren't aware of, or out of pocket costs that were just super high? What did you experience, if you're comfortable talking about that?
Yeah, so our insurance is pretty good, but since I wanted my surgery done like ASAP, they didn't approve the MRI before I got the surgery, so I had to pay for the MRI out of pocket. And
How
I
much
thought
was
the MRI, I thought it was going to be a lot, and it was like $300. And I was like, that's shocking that it's only that much because they bill our insurance like $3,000,
Right, right. They probably have an out of pocket cost or like
Right.
a self pay cost. Yeah. So I think that's really important because not every MRI or radiology facility will do that. Sometimes you'll get bills because your insurance doesn't cover something and they'll try to charge you what they bill the insurance. And I think that even if they do try and bill you what they are billing the insurance, you have to say, listen, I'm self pay. I can't afford this. What do you like? If I didn't have insurance, what would
Mhm.
you charge me? So that's
Yeah.
really important.
Yeah, it was really important. So we had like United Healthcare, and so you know how they have like the Optum stuff, and you have to
Hmm.
like get everything pre-approved.
Right.
So they hadn't pre-approved it yet for the MRI, and that's why I was like, I need this MRI done. My MRI was scheduled that day, and they're like, oh well, we'll try to get it done as quickly as possible, but they didn't approve it till 2 days later, which was
Right.
the day of my surgery.
Right.
So I was like, whatever, I'll just pay for that. And then obviously they paid for my surgery. I think I just had to pay like my deductible, which was like a couple $100s, which
Hmm.
once again, it's really good insurance. So we lucked out in that regards. Assistive devices, I didn't even go through my insurance for those. I just, I had a couple of people that would just bring them in. Like I said, I got the scooter from a friend and the crutches from a friend. So I just bought the iWalk,
Hmm.
and then I bought my own boot. The boot was really expensive. So maybe looking at to go through insurance for that, because it was like $400
Hmm.
for this assistive device that you're going to have to be wearing like long term. But once again, I just went through Amazon for that stuff because I just needed it quick because everything was just going so fast.
The surgeon didn't get you a boot.
We had a normal boot, the one that was like non-articulating boot.
Oh.
So it was just like a normal one, but after you go through the surgery, you have to get a hinged boot. So
Hmm.
you have to like put it at different degrees of range of
Uh
motion,
huh.
then slowly go,
Uh huh.
down. And so he doesn't have those in office. So he was like,
Oh.
here's what I would recommend. And then I did my research too. And like the best one is the Vacoped boot,
Hmm.
which is actually made internationally.
Oh.
So that's the one that's like $400, but it's like the Cadillac of
Right.
like
Right.
boots. It's so nice.
Did you try and submit it to your insurance?
I did not.
Oh, I bet
Nope.
you could now. You should still try.
Yeah,
I always
maybe.
I always tell people like try, you never know. I had one patient who saw me for like 20 sessions and she never submitted. And then she's like, "Can I have the invoices again?" I was like, "Sure, try." I don't know what
Yeah.
happened, but maybe she maybe she got it covered. I don't know, but I never think that there's harm in trying. So
Yeah.
try and let me
Yeah,
know.
I should. Yeah.
Cuz once you have
And
that baby, you're going to want that $400 back.
true. I'm already figuring that out.
Oh yeah, it's bad. It's bad. um so other than your deductible, there were no surprise bills.
No, I think so I had to get MRIs after I had the partial rupture. That one we got approval for that MRI.
Mm-hmm.
So that was went through the normal course. And then I had another MRI another 3 months later because they wanted to check my progress of
Mm-hmm.
my, tear, and then another 3 months later. And so those ones, they didn't actually collect payment in the office. So they just
Mm-hmm.
would send me but it was just my copay or
Right,
whatever.
right, right.
So those weren't that big of a deal. No, I didn't get any surprise anesthesiologist bills,
Good.
luckily, because
Yeah.
usually that's a big thing. Um, but obviously for physical therapy, so I did all of my physical therapy at my facility,
Right.
but I still paid out of pocket for that too, because I was the patient, and so the clinicians were getting paid for those
Mm-hmm.
services, so I had to pay in for that.
Mm-hmm.
So I just paid out of pocket. So I should submit for that too, because it
Oh, yeah.
ended up being 78 visits.
Wow. So, I mean, so you guys build the insurance company for your treatment for each clinician with each
No,
clinician?
I just
Oh,
I
because
pay each clinician,
right,
so
because
that's our
because
model.
you're only in network with Blue Cross Blue Shield. So, and you
Mhm.
have United. So, um, yeah, I mean, I would submit those because, okay, so talk to us a little bit. Now we could talk a little bit kind of about the business side, but from the patient perspective. So talk to us a little bit about how you run your clinic, and the benefits of going with a provider like you or I.
Mhm. Yeah, so
Because
everything is
70
one-on-one.
visits is a lot.
It is.
And
I think it was even more than that.
it's not what most people will get from their insurance company.
No, no. So we have different packages too. So, if you buy a 50 pack, it costs this amount of money, and then that equates to really just $90 per visit, which I know
Hmm.
it's $4,500 up front, but it's 90 visits or it's
Yeah.
50 visits. So
Yeah.
that's a big chunk too. But you get one-on-one time with your provider for an entire hour. So it doesn't matter if we're doing an evaluation or a treatment session or a reevaluation or
Hmm.
testing or anything like that. Everything is completely with a physical therapist for an entire hour. We don't have any PTAs, we don't have any techs. It's just the clinician. So
Right.
it's really phenomenal. You get their undivided attention, and since they're not overworked or burnt out, they actually have time to research things on their own
Hmm.
time. And so Nate would come in, he'd be like, "Hey, I just read this article that says that we need to be doing soleus calf raises at 1.5 times your body weight for 6 reps. That's
Hmm.
the gold standard right now." I'm like,
Hmm.
"Okay, awesome. Let's make sure that we're doing that."
Yeah.
you know?
Yeah.
So
So, I
they're
mean,
able to do that.
that's definitely a benefit of working with. So compared to like the typical model, the mill model, I don't know if other people call it the mill model physical
Oh yeah.
therapy. Yeah. But basically like when you go through insurance, first of all, every insurance company is completely different, or every company and plan is different. So even if you have the same insurance, your plan might be different than my plan, right?
Mhm.
And usually there's a cap for physical therapy. And I really, I mean, I've been out of network for years now, but like the most we would ever get someone would be like 24 visits. Like I feel
Mhm.
like that would be like 2 times a week for 12 weeks. Like that's kind of
Mhm.
where insurance companies like cap it. Some people
Yep.
get 90 visits per condition per lifetime, but so maybe that would cover like, okay, so you do 90 sessions in a year for like this, great.
Mhm.
But then what
Yeah.
happens if you need to go further, or you tear the other, like you re-tear or whatever. So insurance companies really limit your ability to get the amount of care that you need, both in terms of number of sessions for support and then the quality of the care that the provider can give, because in the mill model physical therapy practice they have to see a high volume patient roster in order to make up the deficit in terms of the cost. And then there's, like you said, there's so much burnout in mill model physical therapy because not only are clinicians seeing 30 patients a day, but then they have to take their notes home because there's no time built in for doing documentation for those 30 sessions. So when you're in a practice like the Physio Fix or PRS, where the clinician it's we compensate at a higher rate, but we also see much lower volume, so
Mhm.
that we can provide the care that someone really deserves, which one improves the outcome of physical therapy. And you might actually only need 6 sessions versus 24 sessions,
Right.
but obviously with these surgical repairs or where you really go from non-weight bearing to having to get back to high level athleticism, you are going to want support through that whole entire process, which the insurance will never cover, because they don't care that you're a gymnast. They don't care that you're an
Yeah.
Olympic weightlifter. All they care is that like you have your functional range of motion back, and
You can walk.
you can walk, you can go up and down stairs, you can dress
Yeah.
yourself. They don't have to send someone home to help you get dressed.
Yeah.
That's all they care about. They don't care if you were a varsity wrestler. They don't care about any of that.
Yeah.
So beyond, at some point, physical therapy is going to cut you off anyway, and then you're going to have to pay out of pocket after that. So, but I'm sure you provide invoices, super bills for your
Yep.
clients, and they can submit to their insurance
Mhm.
to get some of that cost reimbursed when we're out of network.
Yep.
Yeah. So
Yeah, and another big thing is like if you go to somebody with an ankle injury and then now your shoulder starts bothering you, in a traditional model, they may or may not treat that, depending on the clinic and the provider. They might just say, sorry, like we can only treat this. And that's what I used to get.
we can only bill one body part at a time.
Right. And it's so frustrating because that doesn't make it a whole person, right? The whole person comes
Mhm.
in and that's what you need to be treating. And they definitely take away the care that we can provide and dilute our services. And it's a
Yeah.
disservice to people.
Yeah, absolutely. Like, you obviously had the Achilles tear, but from the assistive devices and sleeping funny, you had hip pain and
Yeah.
your other leg was bothering you. And a lot of people develop back pain or neck, like let's say it was the shoulder, they develop neck pain or upper thoracic pain that in the traditional outpatient insurance based model, they can't really do anything about, because one, they have other clients coming in. Two, they can't bill for it because they haven't evaluated it. Like
Mhm.
obviously, like we're evaluating as we go. We don't have to do a formal evaluation for the onset of some hip pain over the
Mhm.
last 3 days. Like we can address it and kind of evaluate as we go. So I think, I hope more PTO and PTO and PT practices are going in the direction of where we are in terms of out of network and like one-on-one versus physicians own PT practices are going to be more of those mill models for the future. So if you're a student or a new physical therapist who is listening to this, hook up with either of us so that Stacie, for sure, she has a brick and mortar. I have like just my garage gym brick and mortar. Most of the stuff that I do is online, but definitely we need more clinicians like you and I. So how did this injury change you as an athlete and a physical therapist?
That's a really good question. I feel like every injury makes you more well-rounded as a clinician for sure, and as an athlete, so you like learn how to take care of your body and add in different like tools as you need to. So I think a biggest thing that, when I had my shoulder injury, like way back when and had all those surgeries, I've always continued to add in rotator cuff strengthening and load trap strengthening since then, just to make sure it's like preventative work for anything in the future. And it's worked out wonderfully. And anytime that I feel anything, I just go back to that and it works perfect. And so I do the same thing now with my Achilles. So I add in like at least like 2 days a week of Achilles work. So that could be like, jumping in plyometrics, or it could be like soleus and gastroc work. But I just do different variations to challenge my body in different ways and making sure that I just do that long term. Because if I want to get back into American Ninja Warrior stuff, my body better be able to handle the demands of that, right? So I just now am definitely like, as an athlete, thinking of the tools that I need to keep adding in long term. And then as a clinician also, like, okay, this is eye-opening to me, and it's made me definitely a way better clinician in treating the Achilles, because there's still so much unknown out there. And now going through it with the surgical route and the non-surgical route, I can say that I can see both sides, and I can really help educate people and guide them through this whole process a lot better.
Yeah, absolutely. All right, Stacie, thank you so much for joining us on the Progressive Rehab and Strength podcast. If people want to get in contact with you, how can they reach you?
The best way is probably Instagram, just at the Physio Fix.
She
I'm
does
also
answer her
on.
messages, I promise.
I do all the time.
That's
And
how
we
we
also,
met.
yep. I also have a website. So if you want to ask any questions there, there's a contact me option there. And then I'm on YouTube and TikTok as well.
Oh, TikTok. I don't have that yet. You also have a lot of free programs on your website as well. So tons of sport specific, body part specific programs. If you don't want to work or can't afford to work with Stacie one-on-one or any of her team, there's definitely programs that you can purchase. Stacie has an awesome repertoire of just things, whether it's her Instagram, her programs, her facility. You are just a powerhouse of awesomeness. All right, Stacie, thank you so much for joining us, and we'll see you next time, guys. Bye for now.
Thank you, Rory.